today we're talking about IV infusions. And the question is always, are IV infusions, are they awesome? Do they really work? Or do they just make expensive urine? And the answer is, of course they work. Don't be ridiculous. We're going to talk about why they work. And so for those of you who've ever had an IV infusion, or if you thought that you might one day want to get an IV infusion, this episode is for you. For those of you listening on your podcast while you are washing the dishes or walking your dog, not much has changed. I still look amazing. My hair looks great. And as always, I am wearing the stethoscope that my wife gave me. Hi, Gina. So share this with other people and let them become the game changers in their life. And wherever you are, follow us on Instagram because we're funny. And for those of you who don't know who I am, my name is Efrat Lamondre and everyone calls me E. And I invented the new method where we empower people to realize that their symptoms are not in their head because you always knew there was a better way. So join the conversation. Let us know that you're here. And let's start talking about IV infusions. So first of all, what is IV? I'm sure many of you know, but it's good to say because you never know who knows and doesn't know. So acronym IV stands for intravenous therapy. Intra meaning within or inside, and venous meaning the veins. We're talking about in the vein therapy. So IV therapy is a method of administering fluids and other substances into the body via blood vessels. And it's one of the fastest way possible to deliver medications or essential nutrients to your body. In hospital, you use this all the time, right? You've been in a hospital and you know that all the time there are IVs. When I worked in the ER, most of my days was spent putting in IVs. Why? Because it gets the job done fast. If you come in dehydrated, I can tell you, here's a glass of water, but that's going to take time, right? I don't think anyone in the ER who came in dehydrated received a glass of water. It's going to take too much time to process and go through. So we would pop an IV in, get the fluids in, and voila, the patient's vital signs would improve. If you came in with pain, I could tell you, here's some oral pain medication, in which case you'd probably punch me in the face because you're in a lot of pain and that's going to take a really long time to work. But instead, what do? We put an IV in the arm and give you the pain medicine through the IV so you feel better in minutes. And patients sometimes come into my office, maybe with an infection, and I could sometimes give them oral antibiotics if appropriate. But if the infection is really bad, what do? I send them to the ER for IV antibiotics, right? Why is that? Why is it that in the ER, so many of the medications and the fluids are given through IV? Well, the number one reason is because it's fast, right? It works fast. It goes straight into the bloodstream. It doesn't have to get absorbed through the stomach. It becomes more bioavailable, meaning it's available to be used. It's not going through all this process. So it's more available. So IV therapy cuts the digestion out of the equation, right? It's not going through your mouth and through your stomach and through your liver or through your kidneys. It goes straight to the source of where it needs to go. So there's no breakdown of nutrients and there's no wait time. Your body takes in what it needs and lets go of what it doesn't need. So the very first reason IV works in general is because it's fast. The second is that you can go with higher doses with IVs than you can sometimes with medication. So that's true for supplements for sure. Let's talk about vitamin C for a moment. Vitamin C, when you take it orally, it gets broken down and only some of it gets into the bloodstream. Another word for bloodstream is serum. So no matter how much vitamin C you take orally, by the time it's broken down, the serum concentration, meaning the amount that's in your blood, will not go higher than 9.3 milligrams per deciliter. But if you take it through the IV, you can get as high as 80 milligrams. So what? So who cares? So why do I care if I can get 80 versus 9.3? Well, the dosage matters. Vitamin C becomes antiviral at a level of 10 to 15. It becomes anti-allergy at a level of around 80s. And it's also been used to treat some cancers, and studies have shown that it only works in mega doses through IV and not oral doses. So not only are we talking about how fast we can get it, but we're also talking about that at times through IVs, we can get a higher dose in than we ever could achieve if we're taking it orally. Same is true for magnesium. Magnesium orally, it causes little change in the serum concentration, in the amount that's in your blood. But IV administration can double or triple serum levels for a short time. Again, this is one of those things that we use in the hospital all the time. Hospitals, IV magnesium is used for asthma attacks, for migraines, for fatigue, fibromyalgia, depression, seasonal allergies. It's used for heart patients, and it's been shown to prevent heart failure. So when we use it in the office, um, sorry, backtrack a little bit. So in the hospital, we use it for all of these things. And one of the reasons we use it in our hospital, in the office, wow, today I need some coffee. One of the reasons we use it in our office is not just for these illnesses, but because magnesium is necessary for more than 300 biochemical reactions essential to life. IV magnesium goes into the mitochondria and starts to heal from the inside. So bottom line, why IV infusions? Because IV is quicker and it can get you more. And sometimes you need more. So once again, we're at this crossroads, right? The medical world says IVs are great if you're sick. They're great if you need medicine. But as soon as we say, hey, let's use IVs also for wellness. Let's use the same magnesium that you're okay with using for asthma and heart failure. Let's use it here for wellness. And suddenly it's quackery. Suddenly the same exact thing that you were okay with using in the hospital is suddenly not okay when we want to use it for wellness. And I think we're all agreeing that that doesn't make so much sense, right? Now, I'm not a conspiracy theorist. If you knew me and you hang out with me, you know I'm not a conspiracy theorist. But here's the thing. One of the reasons we really don't talk a lot about vitamins and there's not enough trials for vitamins is because you can't patent the medicine, right? Most of the studies done in our world are from pharmaceutical companies. And God bless them. We need them. We need their discoveries. They save lives every day. So I'm not saying that, that it's the worst thing in the world. We could not be around without life-saving medication, insulin and seizure-saving medications. There's no question we need pharma companies. However, they are businesses, which means they're going to do research and development for things that can produce them money, like medications. They're not going to do research and development on supplements that don't necessarily make them money, anything that we can get without a script, right? So we have to use some of our logic. And the logic is this. If IV infusions work when people are the sickest of the sick in the ER, why is it that when we're suggesting to use it for wellness, does it become nonsense? Why is it that when you're the sickest of the sick, you get IV infusion and no one's worried about whether you pee it out if it's expensive urine? But as soon as we do it for vitamins, we're like, oh no, that's nonsense. All you do is get expensive urine. Absolutely not. You're still getting the most bioavailable supplementation that you can when you get an IV. Now, all that being said, I always like to proceed with caution and tell people that it's never just about the supplement and it's never just about the IV, right? Of course, if you're not feeling well, the first thing you have to do is always, always, always go to your medical provider and rule out an illness. Please don't diagnose yourself. Don't go to Google and figure it out. Always rule out an illness. Don't just run to the nearest IV lounge and just get something because you're not feeling well. First thing you want to do is make sure that nothing else is happening. And also you want to make sure that your heart and your kidney can handle it because not everyone can. That being said, you want to make, once that's out of the way, then yes, you can use it. So in the non-ER world, right, it's really about using this as part of your overall lifestyle, okay? So in the ER, it's not really a conversation. You go in, time is of the essence. You have to get that infection down or the blood pressure down, and so you have to use it. It's an emergency. You have to use it. But out here in the non-ER world, IV therapy is what we like to call part of the complete breakfast. It's not the whole thing. So it's not going to help you if you're leading an unhealthy lifestyle, right? If you're out here smoking, eating McDonald's and then show up for an IV drip, don't expect a miracle, right? Maybe it'll help you a little bit in the overall, but you're not really going to move the needle along much. So if you're putting in a lot of toxins into your body, putting in the IV infusions is not going to make much of a difference. I want you all to be aware of that. I like to use my IV drips. I like to use supplements in general in conjunction with a healthy lifestyle, right? The patient's eating on point, doing the work, taking the health to the next level, moving. And then you want to add this because getting healthy isn't just about removing foods or toxins, right? It's also about adding the good stuff in. So we give our patients supplements, whether oral supplements or IV supplements, in addition to what they're doing. So make sure that when you use IV infusions, while I'm saying that they're great for you, don't use them instead of a good lifestyle. Use it in addition to, as part of it, like the little cherry on top. So a lot of times people ask me, how often? How often should we do it? And the answer is, it depends. It depends. That's the best answer in medicine. It depends. Some people need IVs for a few weeks or months, and then maybe slowly lessen the frequency, or sometimes even come off of it as things are getting better and they're moving over to oral supplements. And some people need it a little bit more often. So some people, as they get progressively healthier, we transition them to less frequent IVs and oral supplements. And then some people maybe will have a stressful event or a decline, and then they revisit and increase it again. So it really depends on what's going on with your life. It depends how much time you have as well. And then I have some patients who just really don't do well without it. Like as soon as they take a break, they feel a decline. And so if there's too much time in between. So this could be due to like the illness that they have. Some people are so chronically unwell that they need this constant additional push. And when they don't have it, they don't feel as optimal. So it's really, really patient specific. Some people could do it once a month. Some people do it twice a week. Some people do it when there's flare-ups. Some people do it when, just before a race or something like that. So it really depends. There is no particular prescription and how often to do it. That being said, there are two types of IVs that do have a certain time frame. I want to talk to you about NAD and Plaquex, which we'll talk about in a moment. Let's talk a little bit first about what goes into an IV, like in general, what goes into an IV. Every IV will have a base fluid, like normal saline or sterile water or dextrose, and then certain things are added to it. So you'll have this big bag of, again, some sort of base fluid, and then you add magnesium, calcium, vitamin B, amino acids, and all kinds of deliciousness go in there. And here at the new method, one of the things that we really love in our IVs, and you can get it wherever you are locally, is we really like glutathione. Glutathione is magic. Our body creates it and it pumps it into our mitochondria, and it works on a cellular level to prevent inflammation and prevent cell damage. And you really need it for your immune system to function properly. However, as we age or when we have chronic issues, we don't make as much glutathione as we need. So we put it in the IV, and it is a really big deal. It really makes a difference when you get that IV glutathione. But there's all these different variations of cocktails that you can use, and it depends on your goals. There is a particular IV called NAD or NAD+. This is an IV that I would say to you guys, this is not a beginner's IV. So you don't want the first time in an IV lounge to go for an NAD IV. Those of you who had it, Those of you who haven't had it, here's kind of what happens. So first of all, what is it? NAD, it's a coenzyme that's super important, and it really helps the mitochondrial level of your cells. So if you're dealing with a chronic issues really affect the mitochondria. So you really want to help the mitochondria along. Aging affects mitochondria, so you want to help them along. So NAD really supports healing, enhances performance, brain function, brain fog, chronic issues. And it's also used for addiction, cravings, and withdrawal symptoms for people who are coming off, who are withdrawing, who are trying to overcome certain addictions. It is also used for that. So depending on if you're using it for that, there is a prescription, which we'll talk about in a second. But before I tell you what the protocol is, I do want to tell you this. NAD is really hard to take. It causes flushing. It makes you feel almost anxious when you take it. People need control over the rate, because if it goes too fast, it's very uncomfortable. So this is not the IV you want to start with. If you're phobic, needle phobic, not sure, do not get the NAD, because it's going to send you over the edge. This is for people who've had a few IVs, you've done some reading on NAD, you know this is what you want. NAD has amazing, amazing, amazing effects, but accepting it into your body is a process. So make sure when you go, you start at a low dose and that you have full control of how fast or how slow it goes. So again, for people who are using it, there is a whole like post addiction protocol, and the recommendation is to use it every single day for 10 days. But for anyone else who's not using it for that, you can use it as a single dose and you're preparing for a race or an event, or use it, once a month. It's really a nice addition to your overall plate. The other IV that I really love and want to talk about is called Plaquex. Plaquex is my personal favorite. It was initially discovered to remove fatty plaques in arteries. And studies have actually been shown with scans that people do before Plaquex and after Plaquex. And the scans are amazing to see. For this, if your goal is to remove fatty plaques in your arteries, the recommendation is 2 times a week for 10 weeks. But Plaquex has also been shown to help psoriasis, improve inflammation, rejuvenate the liver and the gut. So in that case, if you want to use it, you don't necessarily have to do 2 times a week for 10 weeks, but it is nice to add as well. I try to get it once a week, once every 2 weeks. It's my favorite. There is also another amazing specific IV infusion called alpha lipoic acid, or ALA. And outside of this country, ALA has been used in clinics to help with diabetic neuropathy. So there's a lot of studies on the effects of diabetic neuropathy with ALA. And ALA has been used for other things. It's great for the liver, overall for brain and nerve tissue. But I just want to let you know that there are a lot of studies out there specifically in neuropathy, because that's what it's used for outside of this country. So whether you're using ALA, Plaquex, NAD, or a cocktail of various nutrients together with glutathione, the bottom line is this: they work. Of course they work. IV infusions work when you need them in the ER. IV infusions work when you need them outside of the ER. So they work fast, they give you higher doses, they are more bioavailable. And do they produce expensive urine? Yeah, but that's okay because you're also feeling better. So I recommend, of course, using them in conjunction with your overall health plan, not instead of. You can't go out there and, have an unhealthy life and then come in expecting it all to go away. You want to do it as part of your overall health plan. I hope this helps. As always, if you have questions, let us know. You can reach us just about on every platform except for Twitter at The New Method. Of course, if you want to work with us, you could just reach out to us at The New Method. New is spelled with a K. Share this with people that you love. Share it with other people who want to become a game changer. And I hope to hear from you on any particular platform that you're on. And I look forward to hearing from you. I hope this helps. You always knew there was a better way. I'll talk to you guys soon.